To my left, Dr. Emmanuel Okunga. Dr. Emmanuel Okunga is the Assistant Director of Medical Services, and he's also a medical epidemiologist. We'll also have Lydia Kamau, who's a nursing officer, and she was a volunteer at the African Union Support to Ebola in West Africa, and she was specifically in Liberia. We'll have Peterson Washira, who's a clinical officer and was the team leader for the same African Union Support to Ebola in West Africa, and he was based in Sierra Leone at that time. So we go back to 2014, and Africa experienced one of the worst disease outbreaks in history, the Ebola virus. Tens of thousands were affected, 11,310 people died, and over 10,000 survived the virus. This experience taught Africa and the world a lesson in disease outbreaks, preparedness, and response. When the African Union sent its support to Ebola outbreak in West Africa, Kenya was one of the countries that sent a team of volunteer health practitioners to assist in managing the outbreak. Has Kenya learned anything from this experience, especially because the country is not immune to disease outbreaks? We have had several outbreaks, from the most recent reports of chikungunya virus in Mombasa. We previously had cholera in July and December of 2017. We had Marburg in November of 2017 and a yellow fever incident in 2016. And that's where we'll start the discussion with my panelists this morning. And I'll start with you, Daktari, being a medical epidemiologist. Has Kenya learned anything from the Ebola outbreak in 2014, and knowing that we are prone to other infections like Marburg, which was from Uganda? Have we learned anything from then?
First, thank you so much, Mercy, for having us. We must start from the point that Kenya actually sent a contingent of staff to Liberia. And from that, we had a lot of learning points, because out of that, we've already been able to improve our systems, our surveillance systems, our response systems. And we've also been able to establish an emergency operations center, and our response capacity has gone up.
Okay. Lydia, you are in Liberia. Now you're back in the country. Do you think we've learned anything from your experience from Liberia and seeing what we do here?
Thank you, Mercy. It's true, we are, just like Dr. Ria said, it's true we are better than how we were before the Ebola outbreak. I'm seeing we have changes in our infection prevention department. We have changes in surveillance. We have changes in reporting. And the public is well aware that this is something that could also happen to Kenya. And being prone to communicable diseases, then we should be more vigilant, which the government is really trying to implement. Although we are still not yet there, but we still believe that much is needed in this sector.
Okay. Yeah. Peterson, have we learned anything from the experience from West Africa?
Yeah. Thank you, Mercy, and thank you for having us here today. As Dr. has said, I think there may be some minor improvements, but especially as the team leader for the Ebola team, I want to say that there is much that we think should have been done that has not been done. We have been able to present a proposal, because we know we have an emergency response team, but it's actually a technical committee that just overlooks. It's a policy maker in the ministry. But do we have the technical capacity down there, those who can be able to implement the policies being made at Afya House? I think that is the biggest question, because when it comes to these outbreaks, it's not about the policies you make. It's about how well can you be able to mobilize the communities. Do you have expertise on the ground that have the grasp of what you are dealing with? And I think, yes, there may be some improvements. Personally, I don't know. But I think there is much that needs to be done. And we have not seen our proposal being implemented. So for me, I would say, I don't know.
Okay, I want us to listen in to what some Kenyans had to say about our preparedness for disease outbreaks and our response. So let's take a listen in to what some of the Kenyans had, and then we'll come back to this discussion.
Easy to solve the issue of the spread of diseases, especially when it comes to, for instance, malaria, when the government, in conjunction with the county government, can create awareness with the people so that they can be aware that malaria is spread through several channels. For instance, when it comes to stagnant water, the people should be enlightened to ensure that their residential area there is no stagnant water, which will harbor mosquitoes to lay their eggs, and in turn, it will create effective channel for malaria to be spread with them. Again, issue of cholera. Cholera is one of the diseases also that can be easily controlled when people are enlightened on the causes of cholera. For instance, the issue of sanitation, people should be made aware, to be aware of how the disease can be controlled.
National government should chip in providing funds to cater for eradication of some diseases, because the money in the counties is not enough to cater for all that.
Watu wengi wanapokosa madawa kupitia kwa government, tutakuwa na upungufu wa population in our country. Two, government inafaa kuingilia kwa kuwapatia madawa, kusupport the hospitali ili iweze kusaidia hao ambao wameadharika na outbreak of disease, e.g. cholera.
In the last 5 years, miaka mitano ambayo imepita, naona kwamba kuna improvement, kuna mabadiliko nyingi sana. Manake kama ni ugonjwa inachipuka, mara nyingi ni vigumu sana kujulikana kwa mara moja. Lakini naona kwamba serikali wamejisatiti, wameweza kupambana nayo. Kila ambacho pengine ningeweza kusema ni kwamba ile response ama ile kuweza kukabili magonjwa hayo, waweze kumove speed, waende kwa haraka. Hiyo ndio waweze kuimprove.
Serikali ina uwezo ya kuzingatia kuangalia haya magonjwa. Kicha kwanza wanastahili wafanye, wajaribu waweke expert, waandike experts ambao wataweza kuzingatia kung'eng'ana na hao magonjwa.
Tungeomba wakati yenye serikali inagawa pesa, izingatie sana wakati wa kugawa pesa. Kwa sababu unapata hizi machines zenye serikali imekuwa ikisupply kwa kila county, unapata county zingine hazina. Kama mtu kama mimi natoka county ya Trans Nzoia, na ukiangalia county ya Trans Nzoia, hata hiyo mashine ya cancer sidhani kama iko. Kwa sababu resources budget yenye serikali ina allocate haiwezi keta kwa county ya Trans Nzoia kununua hizo machine, kwa sababu zile machine ziko so expensive. Sasa hiyo county kiseme hire from outside other country still haiwezekani. Sasa kitu kwenye tungeomba serikali allocate pesa nyingi kwa mambo ya matibabu, at least wananchi weze kwa access hiyo matibabu.
Okay, many questions raised there, from funding for these disease outbreaks, presence of expertise, and the response. Dr. I'll start with you, because many fingers from the public there have been pointed on the government and its actions when there's disease outbreaks. And one of the questions that I would want to ask specifically from what we've heard is that the response time sometimes may not be adequate. How come the government does not respond as quickly as you would have wanted them to respond with these a disease outbreak? Take cholera, for example.
Thank you so much for that question. Now, you need to understand the structure of our surveillance and response function in this country. One is a shared function between the national government and the county government. And most often than not, we respond to requests, the national government responds to requests from county governments. When county governments are overwhelmed, then the national government moves in to give technical assistance, to give resources. And we think that from the recent outbreaks, we are making progress, because there was a Marburg outbreak in Uganda recently. The national government, working with the county governments of Trans Nzoia and West Pokot, managed to ensure that we did not have cases in Kenya. we're able to follow up very many of the contacts, and we ensured that within 42 days, there were no cases. We've also been able to respond to cholera outbreaks in many counties, and we've successfully controlled cholera outbreaks in more than 20 counties. We are currently supporting the county government of Mombasa to respond to the chikungunya outbreak. More effort still needs to go there, but we think we are moving somewhere.
Okay. Peterson, do you agree that there's good response, let me not say quick response, there's good response to some of these outbreaks, as Dr. is saying?
Yeah, I think from their bit they may be trying, but I think it's not that adequate as it should be. I've seen people say that we are now able to be able to report outbreaks very fast, to know that there are outbreaks. But what we don't know is that those outbreaks should not be there in the first place. And I think there is a problem with the health system in this country, the way we prioritize things. We are a more curative health system than preventive. And health is supposed to be the other way. If you look at even the counties right now, they're not employing public health officers. The public health aspect that is supposed to be preventive so that you don't get these choleras and the likes, they're not being employed. It's not a priority area. And so one case of cholera, how many people have died from cholera? In a country that boasts of moving from the underdeveloped to a middle-income country. I think in the health system and the level at where Kenya is, we are doing badly. Look at the outbreaks that we have had. We have had the cholera. We have had the chikungunya. We have had the dengue. It's only one outbreak that the ministry was able to utilize the expertise that they sent to West Africa for 6 months, those who have gained skills. And I think the same way I'm saying the priorities in the health sector. Because like, how do you take 170 medical practitioners who are of the right mix? Because we had all cadres combined. And these are the cadres that can be able to respond to an outbreak. You take them, they gain the expertise, then after they have gotten the expertise, you do away with them. And it's actually sad to note that it's a deliberate decision by the ministry. Because I remember like when we came back, the president pronounced himself that these are people with the right expertise, and they have also demonstrated that they are courageous enough. They can be able to stand for their country when such fatal illnesses come, when nobody else wants to be involved. And he said that they should be engaged. But then when it reached to the side of the ministry, they have treated us with indifference. But if you're asking if we are doing what is adequate, I think there is much that needs to be done. I don't think that the ministry and the county governments and the health department as a whole has been able to sit and look at this. I think there must be a lot of disconnect between the national government, Afya House, and the counties. And maybe Dr. can guide us here. But from my viewpoint, I don't think what is being done is adequate. Luckily,
Dr. Do you want to...
Kindly let me respond to that.
Okay.
Now, first, we must correct the impression that the ministry is not and is entirely curative, because we have a whole department of preventive and promotive services under which the division of disease surveillance and epidemic response falls. And one of the key functions of the department is surveillance. And it is out of surveillance that we are able to detect these diseases early, in fact, prevent, because we do routine surveillance. We have a network of over 5,000 people doing disease surveillance in this country. put together with community health volunteers that assist us also, have a network beyond even 20,000 that is doing surveillance work. So in terms of detecting diseases, detecting outbreaks, I think we're up there. I've also mentioned that we have an emergency operations center where we do event-based, what we call event-based surveillance. And we receive calls from communities on a 24-hour basis daily. So we cannot say the government is not doing much. Two, Peterson has also raised the issue of organization at county level. Of course, we know there are challenges that have had to come with devolution, but we are adjusting, and I think we are now getting somewhere. And the national government has done training of more than 5,000 disease surveillance officers, because the structure of surveillance here is that at national level, we have the disease surveillance and epidemic response unit. At county level, we have county disease surveillance coordinators. So that makes them 47. At sub-county level, we have about 300 sub-county disease surveillance officers. And in every hospital, we have a surveillance focal person. So the network to detect these outbreaks is there.
Okay, I would want to take a break and then we'll pick it up from there, because one of the viewers that we talked to said that we probably do not have the right expertise on the ground when it comes to disease outbreak and response, yet you've told us this whole system of expertise. So I think we'll pick it up from there. We'll take a short break, and when we come back, we'll pick the discussion from there. This discussion is on disease outbreaks and the response by the government and by the community when there's disease outbreaks. So we'll take a short break, and we'll come back and pick it up from there.